Well, what if I told you just a gentle touch, so gentle you hardly even notice it, could maybe help to cure lower back pain that you might have suffered with your entire life? Well, Dr. Jamie Kaiser is here this morning to talk about NUCA, and with patient Tiffany Barsotti as well. And you had lower back problems?
Yes, I've had re-herniated multiple times, herniated discs and re-herniated multiple times over the last 20 years.
So you were getting no relief from other types of treatment or limited relief? What was the story?
I did prolotherapy. I was doing everything to avoid surgery, especially in my 20s, to have herniated discs.
Yeah, of course.
So I really didn't want to go that route. So when I did prolotherapy, these are injections, I did Pilates, all kinds of physical therapy, and it would do a certain amount, and then, you know, of course, chiropractic, typical chiropractic, but it didn't get me
So
there.
how did you find Dr. Kaiser?
You were actually online researching, side note on there, but she was actually researching her master's thesis, and it dealt a lot with the upper head and neck area.
Yes.
And from when she heard about that, it kind of made so much sense in that she had been typically, people with good intention had been treating her symptoms. If it's her lower back that hurts, we must address the lower back or strengthen the lower back. And with NUCA Care, which is what we do, we focus on getting to the root of the problem. And if there's a misalignment up here in the very, very top, it can distort the whole entire posture all the way down.
And folks are hearing this for the first time, and they're hearing about NUCA for the first time. Let's take a look at some video and kind of explain here what you're doing, because
this is a typical NUCA adjustment,
which does not look like what the traditional chiropractic adjustment.
Very different than traditional chiropractic. The most amount of force that's actually Angie right there. The most amount of force that Angie is feeling. If you've ever had your pulse taken, we're talking about slightly more pressure than that, and that all works. I'm actually measuring out with a tape measure there, because based on the measurements and testing we've done beforehand, I actually do a whole bunch of math stuff and figure out exactly where I have to stand so that everything moves in the right direction. And again, very gentle. I describe it as extremely underwhelming.
Okay, so now, can you make the connection easily enough for viewers at home about why making a subtle adjustment in the neck gave Tiffany such great relief with the lower back?
Right. Simplest way I think to put it is, as we're sitting here right now, okay, as people are sitting at home, our postural muscles are working. We're not having to think about sitting here right now. We're not having to. We can always sit up straighter if we want to.
Yeah, I probably.
But
Thanks for the reminder.
We're already here. We're already sitting there, and so our postural muscles are always working, every single second, except for when we go to sleep. We just never think about it. The signals for your posture originate up top here in your brainstem. So if this area is too far out of place, and the signal from this area down to those muscles can become imbalanced. And so that's why when people are working locally, like they were doing with Tiffany, and trying to treat her jaw area, or trying to, for like the TMJ issue she had,
right.
Treating her lower back for the herniated disc, they're good intention treating the symptoms when the signal from up top is still throwing things off balance.
So you did get some relief from these other types of treatments, because they were helping with the actual acute symptom, but they weren't going back and treating the cause.
No, and in less than 3 months, I had a profound change. So the biggest clue for me is I was working out one day doing a squat, and I turned my head to check my form in the mirror, and I felt something pop in my low back.
Oh.
And I knew that pain, it was familiar to me. So, and isn't that interesting? I turned my head and felt the pop in my low back.
In your back.
So yeah, and that was the last time I dealt with it. It was over a year ago, and I can feel great.
Now I want to just direct folks' attention to the screen here right now, and just let you know that for the first 18 viewers, if you schedule an appointment today, you'll get an incredible deal here for just $49, $199 value. This is a consultation, exam, and X-rays. All just for $49?
All $49. People can come in, sit down one-on-one. We'll go over what's happening. I can run some measurements, find out if they may be a candidate. There's no charge for any of that. If we decide to move forward, the charge is only $49. They do need to book the appointment today. They can either do it online or give our office a call. It must be booked, though, today. By tomorrow morning, we raise it back up to $200.
And you like to have it booked today because you hold a certain number of spaces, and then you go ahead and start booking your regular patients again.
Exactly.
I just want to ask you just a couple more questions about how long it was before you got relief, and did you notice relief after how many treatments?
Pretty regularly. He also has these magic tables that you lie on, and they do something. It feels like nothing, but they're doing something. So between his treatments, which seemed very passive, I would say that and the tables, within a couple of weeks, I was feeling relief.
And the changes in your bite in the jaw?
That was big, because what I noticed that was sort of the tipping point of when I made the phone call as well, after I knew about NUCA, is I knew that I was clenching, but I was clenching only on the right side of my jaw.
Okay.
So, and my bite was being adjusted, and my dentist said, we're not going to chase those little blue dots around your teeth. Something else is going on, and so this actually solved it.
Fantastic. Folks, take advantage of the offer for just $49. And for more information, you go to san-diego6.com. Dr. Tiffany, thank you so much.
Thank you.
Next time you're going to tell me about these tables and what they do, okay? Remind me, because we want to talk about that, because it's not magic. It just feels like it.
Yes.
Okay. Thanks. Good to see you both.